So are you guys seeing this? No, not yet. Okay, perfect. So IL-23 mediated resistance to anti-TNF. Anti-TNF responders, when patients respond to anti-TNF, what's happening is there's induction of apoptosis and resolution of inflammation. And so what we're seeing with anti-TNF non-responders is there seems to be an abundance of IL-23 around that actually leads these cells to be resistant to apoptosis. And so what you could imagine if that you had a patient who is not responding to anti-TNF or maybe losing response, perhaps what is happening here is there's an abundance of IL-23. And so you can start to see why we're thinking about anti-IL-23s in combination with anti-TNFs for those who are non-responders or lost response to really boost that signal and increase that induction of apoptosis. So let's see, are we going to get back to the question?
All right, so Jess probably gave you the answer, but think about this. So you're using a TNF, first-line therapy, you're not seeing a response, and the question is why. So take a second again to answer the question. Is this drug interactions between anti-TNF agents and immunomodulators? Is this heightened production of IL-23 and the development of apoptosis-resistant T cells? Is this downregulation of TNF receptors on monocytes, or do you still not know? So take a minute to answer this. We'll see the responses, and then we'll have a bit of a discussion. All right.
Yeah.
So, Jess, what do you think? Pre and post?
So I'm impressed with how many got it right in the pre. I think this is actually a concept that, I became aware of actually fairly recently. Mm-hmm. And so the majority of you got it right in the post test, so that's great. So again, this is heightened production of IL-23 and the development of